All right, Mike, and can you pass the host license back to me, please? All right, Mike, and can you pass the host license back to me, please?
Linda, I just wanted, oops. I just wanted to suggest that we do a survey of the board after, when the motion passes, to figure out how best to monitor the situation in the schools as per your suggestion. So we'll do that as a follow-up to tonight's meeting.
Thank you very much, because
Okay.
I think we seriously have to address this, and I've always appreciated your leadership.
Thank you. Thank you. Well, let's work on that. We'll get the motion, we'll decide on the motions, and then we can, move forward with best next steps. But we'll definitely poll the board to figure out best options for how, when, where, all of those questions. It's a lot to consider.
Yes.
Okay, great. So let's see. It appears to be 4:30. Ronnie, I'm not sure that everybody's here, but can you begin the roll call, please?
I can. I just need you to do an official call to order.
I'd like to make an official call to order.
Thank you. So when I call your name, please answer with present. Representing Adams County on the Board of Health, we have Julie Mullica.
Present.
Rosanna Reyes.
Present.
And Julie Shills.
Present.
Representing Arapahoe County on the Board of Health, Jan Brainerd.
Present.
Dr. Thomas Faywell.
Present.
Dr. Kaya Gallagher.
Present.
And representing Douglas County on the Board of Health, Dr. Linda Fielding.
Present.
Kim Muramoto.
Present.
And Zach Nanestead.
Present.
Now I'll begin roll call for Tri-County Health Department leadership. Michelle Ashkenazi, Director of Emergency Preparedness, Response, and Communicable Disease Surveillance.
This is Sarah Garrington. I am filling in for Michelle Ashkenazi.
Great, thank you, Sarah. Heather Baumgartner, Director of Community Health Promotion.
Present.
Lisa Bolstad, Administrative Assistant.
Present.
Jill Bonchinsky, Director of Nutrition.
Present.
Namrane Brockman, Executive Assistant. Monique Didier, Director of Administration and Finance. Dr. John Douglas, Executive Director.
Present.
Maine Furman, Director of Human Resources. Penny Grandy, Director of Nursing.
Present.
Brian Halabasek, Director of Environmental Health. Jennifer Ludwig, Deputy Director.
Present.
And Dr. Kelly Weidenbach, Director of Planning and Information Management. And I don't think Kelly's here either. That roll call is complete.
Thank you, Ronnie. I wanted to thank all the board members for returning after our very lengthy meeting yesterday. And we have shared some draft information. I'd like to begin this meeting by explaining the justification, the rationale for considering a mask mandate in schools. All of you have received this rationale statement. It is also posted on the Tri-County website, but I just wanted to highlight some of the key aspects. So yesterday, when the Board of Health met in its executive session, we met with our attorneys to confirm that the Board of Health does indeed have the legal authority to approve public health orders. I think we're well aware of what's happening with the Delta variant. It's much more contagious. It's now the dominant strain. And I think the worrisome aspect of this is, even though the cases are low at this point, they have been increasing for the past 6 weeks. It's something the health department's keeping very close tabs on. The Board of Health has also paid attention to the CDC recommendations, as well as those from the Colorado Department of Public Education, Health and Environment, the American Academy of Pediatrics, and the Colorado chapter of the American Academy of Pediatrics. We recognize that vaccination is the strongest line of defense to limit COVID hospitalizations and deaths. Some have expressed concern about the safety and effectiveness of mask wearing, but the evidence we have compiled suggests that the advantages of wearing masks outweigh the risks. In particular, we are aware that mask wearing requirements can minimize the disruptive effects of isolation and remote learning, which I'm sure all of us feel is really important in terms of the continuity in the education of our school-age kids. Currently, 9 of the 15 school districts within our jurisdiction have already set up some type of mask mandate for school-age children. We've heard opinions on both sides of this issue, and many parents have strong feelings both for and against a mask mandate. Our priority is to use the best scientific-based information that we have available to us to protect our school-age children and their families. So before we actually move forward to consider a motion, did any of the board members want to make any comments?
Madam Chairman, I think we ought to put on the record that today is a continuation of the meeting from yesterday.
Thank you. Renee, please put that in the minutes. Okay. Yes.
Jan, 2 things. I am not seeing on my screen today where to raise my hand. I'm seeing Q&A, record, share screen, chat, and participants.
Hit
Okay.
participants.
Can anyone help me?
Hit participants.
Pardon me?
Hit the participants. It'll bring up a list.
Right up there now. Okay, now it showed up. Raise hand, it showed up.
I just turned it on, Jan.
Oh, thank you, Renee. Okay. I'm going
Okay,
to
great.
raise my hand. There you go.
Great. Okay, I know we've been sharing information. There's just an awful lot of, we've been receiving a lot of emails. We have talked about this extensively. Any last opportunity for anybody to make a comment before we consider a motion? Yes, Dr. Faywell.
In reviewing the rationale page, when you come to the expert recommendations, CDC, the American Academy of Pediatrics, their positions are known to us, but their positions are based on what appears to be regional problems. And we've all seen the reports of the southern regions, Florida, Texas, in areas of high unvaccinated populations. And while we do have an increase in cases, which puts us in what they have termed high transmission, our cases and our transmissions don't equal hospitalizations or deaths. Our metrics don't go along with what the experts are saying. Just pointing that out. When it comes to the section on science, there's no significant health effects from wearing a mask. Having spent 35 years in a mask in surgery, I can attest to that. I can't attest to whether or not wearing a mask is a psychological problem or a learning problem, since that's not my field of expertise. And sometimes it appears that children follow the examples of their parents. If the parents don't like it, seems that the children don't like it. Also, we state that it assists in reducing transmission. I feel that some people who are vehemently for or against the mask, when it comes to those for the mask, don't understand that it's reducing transmission, not eliminating transmission. If you think that the masking of children is going to stop anybody forever getting an infection, we're probably giving the wrong message. As to in-person learning, before COVID, there were interruptions in in-person learning. There were schools that were closed for infection. It wasn't COVID. There were other things that can close a school. Yes, we can mask, and masking has shown that we don't have as many, perhaps, if we also do the social distancing, the hand washing and all that. And if we're mandating masks, maybe we should be considering mandating the other mitigating factors that we could use to reduce transmission and disease. Just saying.
Yeah, thank you. Would you like to actually make some suggestions to enhance the rationale or add in some additional information?
Well, let's see how the motions go first and what discussion we have with that, Kaya.
Okay, thank you. Jan, did you have comments?
I did, real quickly. One thing in regards to what Thomas was speaking to, I think that for those that were worried about the effect of masks on children, I personally believe, having been a pediatric nurse, the pediatricians would not have recommended anything that would be harmful to children. Now, that's not to say what the people that are against masks, I'm just addressing the probable effect of masks that they feel would be harmful. I would like to thank everyone too who took the time to comment or send in comments, because we can certainly see how important this issue is to all of you. Again, as a health department, we're charged to protect, prevent, and improve the population health for all those in our jurisdiction. And I want to assure the public that we have studied, researched, read, and asked questions to understand where we are with COVID and any mitigation strategies, and are dedicated to do what we can help to conquer it. My assessment is that mask wearing will protect the most vulnerable children and all of our children, and allow them to stay in school with their peers, to continue their educational advancement, as well as putting their social and well-being social and mental well-being going in the right direction. And last but not least, I'd like to say that whatever the decisions that are made today, I urge all parents to take a breath and be positive about what will happen for your own children, just to lessen any of the confusion or distress they may be feeling, because we as parents owe them that. Thank you.
Thank you, Jan. Dr. Fielding.
I just wanted to bring into the record here that the Public Health Department also has other mandates, and this is always an assessment of risk versus benefit. And we do have mental health issues as well that we are mandated to look into. And there has been a tremendous increase in the pediatric population, for whatever reason, in suicides and mental health hospitalizations. And so I would actually say that we have to balance the needs. And I heard a lot last night of very passionate people on both sides who I respect. But that we are also looking at the broader picture and are trying to balance whatever happens. We are trying to balance the risks and benefits for this community.
Thank you. Rosanna?
Yes, I wanted to know if John would speak briefly about, was the Jefferson County Public Health Order on our list? I didn't hear, or you're in your opening, Kaya? Today, their order for today for masks.
Yeah, Dr. Douglas, did you want to comment on that?
And then I have a point after this. That.
I'm sorry, I had a little trouble here. You wanted me to comment on the Denver order, Rosanna?
No, today's Jefferson County public health order for requiring masks.
Well, I probably don't know a whole lot more about it than you all do. I haven't really read the text of the order. It's my understanding from talking to Dr. Comstock that it was going to be an order that was going to be covering all mask wearing, all ages, vaccinated or unvaccinated in schools. I think that was the core of it. But I don't know whether either Melissa or Jennifer may have actually had a chance to read the order in more detail.
Dr. Albanese was saying that it's actually Denver. Did you want to speak, Bernadette?
I'm just notating that there was a press release sent out by Denver Department of Public Health and Environment about their mandate, and that came out within hit my email within the past couple of hours. So Jefferson, I thought was a little while ago.
Last night or yesterday afternoon.
Oh, yesterday? Okay, yeah. So a couple of more recent ones.
So Rosanna, was that enough information? Did you want to add
Yes,
anything?
I did. I just wanted to clarify that because there was so much to read. I just wanted to clarify that Jefferson County has a public health order mask mandate, as well as Denver County now. Thank you, Bernadette Albanese. But I also want to mention health equity. Tom talked about regional approaches that the AAP, American Academy of Pediatrics, has been trying to address in CDC. We have regional issues in the Tri-County Health Department district. We have health equity issues. And as board members, we represent the whole region. We have an obligation and a duty, as it was outlined in the rationale, to promote, prevent, and protect the public health. So I just wanted to mention that because that wasn't brought up in the rationale, that health equity is a big issue across the Tri-County Health Department region. Not everyone has adequate access to levels of primary care or medical home or hospitals care. So that's something as well, as we do that balance, as Linda was saying, that's an important part of that. So thank you.
Point well taken, and we can certainly make sure that gets added into the rationale. Kim, did you have a comment?
I just wanted to reiterate some items as it relates to that mental health and the suicidality with our young people. You know, Children's Hospital has declared that an epidemic. That is a true epidemic. And we are seeing kids literally drop dead from depression and suicidality, which is a part of, our responsibilities here. I do appreciate all the passion, of course, the parents and teachers and the community members have around this issue. And our intention is not to be divisive. I really believe that everybody on this board is wanting to focus on what is in the best interest of the kids. And this also becomes more of an ethical issue. Where are we going to cause the least harm? And how are we going to protect people the most? So I want people to just, in making this decision, really think about the whole child, because that's what we're talking about. It's about kids. And while the American Academy of Pediatrics may say, yes, we want masks because it does decrease some of the, I think, transmission, it doesn't certainly, as Dr. Faywell had stated, it certainly doesn't prevent it. It still can go through the masks. It's the vapor that can still transmit through that mask. However, we know that Delta it's highly transmissible. We totally agree with that. I also did cite a study that it was a high-powered study through Germany that measured many children that did have issues around masking. So I think there's two sides of the coin. It's not always that medical people are always on one side or the other side. I just think we need to really focus on the data. And as long as we focus on the data and do what's right for the patient, we're always going to come out whole. Thank you.
Thank you. Julie Malika.
Great, thank you so much. So I have some comments as well that I'd like to share with everybody. So thank you for the opportunity to speak. Oh, wow, this is been an exciting, 24, 48 hours. First of all, I just want to thank everybody from the community that invested their time in speaking yesterday. I know that there were a lot of people who committed and, hung on to the meeting, wanted to talk, did have the opportunity to speak, and some didn't as well. But we received hundreds of emails, lots of comments, and thank you for that. I think that it's important that we continue to get that feedback. And honestly, I understand the passion, right? Our kids are our world. I have 2 kids myself, a first grader and a third grader, returning to school tomorrow. So I know what it's like to have young kids in school during a pandemic. I lived it. I've seen it. I've experienced your frustrations with schools as our kids are shuffled from online school to in-person learning. I too had to become a teacher. I became a kindergarten teacher last year and a second grade teacher. And I do understand how it has strained my family's relationship and my relationship with my kids. I had a kindergartner last year, a 5-year-old boy, who honestly really struggled with online school. Every day ended in tears. And every day he would just be so frustrated with having to sit there in front of a computer to try and make connections. Now, I will have to say, once in-person learning resumed, he became a new person. He became the beautiful boy that I know who loved learning and who learned to flourish socially. He made new friends. He made new connections with teachers, all with a mask. So yes, I understand people who are concerned about their kids making relationships. My kid became a new person by going to school. And that is what is probably the biggest issue for me when I look at this. So we're living in unprecedented times. And as much as I wish this pandemic was ending, I'm just, along with everybody else, it's not. It seems like we're in for another round. So today I'm basing my decision based off of my experience as a mother, as a public health professional, and most importantly, as a community member. So with the overwhelming number of medical professionals and their corresponding organizations urging for masking in schools, with the CDC recommendations recommending universal indoor masking for all teachers, staff, and students and visitors, regardless of vaccination status, I can't find the heart to disregard their recommendations. And so therefore, I support a universal masking mandate for our schools, because at the end of the day, it was not the mask that hurt my child, it was them not being in school. Let's get back to learning. Let's not make this more complicated than it needs to be. We need our kids in the classroom. We need our kids and our teachers focusing on learning. We can't return to another year of shuffling from online to in-person learning. The best thing we could do for our kids is to give them the consistency they deserve. Masking is an important tool we just don't have the luxury to avoid using. Is it the end-all be-all? No, we need to continue to keep all of the other structures that we had in place with the hand hygiene and our social distancing, but we couldn't just forget, we just can't throw masks aside. We need to follow the science. We need to listen to professionals that have dedicated their lives to study and research. This is about protecting our kids. It's about protecting our teachers, and it's about protecting our community. At the end of the day, the Delta variant is more contagious. We all know that. CDC recommends masking in our schools. And that is what we're voting on here for today. Are we going to be a Board of Health that listens to the guidance of our healthcare workers and their professional organizations? Are we going to be a Board of Health that follows CDC guidance? Are we going to be a Board of Health that lets politics control the conversation and supersede the recommendations we're hearing from experts and medical and public health professionals? That's what we're voting on here today. And so I just think that that is just such an important statement to make as I run and make our first motion for this evening. And so with that, Julie Mullica.
Julie, could you hold that for a minute?
Yep.
Because there are two other people that wanted to comment. And I'm seeing in the chat that the public is asking if they will get a chance to comment or ask questions. This is not an open hearing. We are having a conversation as the Board of Health. We are still open to receiving emails as we have throughout the day. And certainly you can post questions to the Tri-County Health Department call center, to the Tri-County Health Department staff. We recognize that there are a lot of questions about the rationale. It's just something that we're going to continue to work on to justify. We just want to make the best decision possible. That said, Julie, do you have a statement you'd like to make?
Linda has something.
Yes, thank you. I won't take a lot of time. Similar to Jan, I am a pediatric nurse, and I've spent much of my career working in pediatrics, as well as communities, with providers, with family members, with patients, to really implement and inform evidence-based medicine. The CDC, the American Academy of Pediatrics, our states' provider organizations have always been a source for me in guiding how I delivered care. And I don't see that being any different now, considering the pandemic. I want to thank everyone for the comments you have shared, for showing up, for being a part of your community. I also want to thank my fellow board members. I can guarantee we have all spent time reading, listening, trying to make a decision that is both backed by science, and be thoughtful, as Kim indicated, of thinking about our communities and the children in the communities. I want to echo the statement that as a Board of Health member, not taking into consideration language that was a bit threatening towards us in terms of making decisions, or a bit along the lines of bullying, and definitely that politics have not played any role in making this decision, but being thoughtful members of the Board of Health, being passionate about public health, and really considering our 3 counties, the community members in the counties, and the discipline and the evidence that we have before us related to science and medicine.
Thank you. Dr. Fielding.
Thank you very much. If we're going to be more explicit about what we're going to be doing, I guess it's time for me to be fairly open about this. I am a physician. I have been an associate professor at the University of Colorado. I have read a lot of scientific papers. I have been a scientific reviewer. And I'm going to tell you the dirty little secret that it's not the science. This has been an unprecedented confusion in COVID. We have had major papers from lead journals in the New England Journal of Medicine, in the Lancet, retracted. Unfortunately, politics has come into our science. And the first rule of a physician, I believe, is to do no harm. And so until I have basic evidence that in Colorado, not based on our modeling team, not based on other regions, I'm going to be very reluctant to take local control away from the people. And that's the way our system, you may not like it, but I am an unelected bureaucrat. And I have an extraordinary power that I can overrule your elected officials. I can overrule your school board, who you will elect members of in November. I can do that. But I am very reluctant to do that unless there is a clear and present danger. And currently, our governor has not said that we have a mandate for this. And so I am advocating watching this very strongly, because things can shift in a day, but we can put masks on in a day. So at this point, I'm going to be very reluctant to support mandates, because I don't want to take away the local control of the people and the parents who are passionately concerned about their children. Thank you very much.
Okay, thank you. Lisa, is your hand up? It looks like it is.
I'm sorry, I must have clicked it. No.
Okay, just checking. Okay, so we have had an opportunity to hear from the Board of Health. Some of the public has asked if we're following Robert's Rules of Order. We were just having an opening conversation about the pros and cons. Julie, did you want to take the floor?
Yes, thank you. So I just wanted to set off our first motion. So I move to authorize and direct the Executive Director of Tri-County Health Department in response to the COVID-19 pandemic and to support and limit interruptions to critical in-person learning to issue a public order requiring the use of face coverings for all individuals in all indoor school and childcare settings located within Adams, Arapahoe, and Douglas counties for both per Board of Health policy. Counties have the option to opt out, and if a county exercises that right, it does not preclude any school, school district, or child care facility from following this public health order.
Great, thank you. Is there a second?
Second.
Thank you. And now we'll open up for conversation about this motion that's on the floor. Rane, this is a little late. Can we actually post the language as a screen share?
Jennifer's actually going to share. I don't have the language.
Okay, so actually, Jennifer, it's really just the first motion, and just because there was a lot in that motion, it would cover. Let's just read it in person. All individuals in all indoor schools and childcare settings. And then the second sentence says, the Tri-County Board of Health has issued an opt-out order for any public health orders that are county-wide. And so the second sentence of this motion says, per Board of Health policy, counties have the option to opt out. And if a county exercises that right, it does not preclude any school district, or childcare facility from following this public health order. So we're leaving it up to the discretion of the school and the school board to make the decision on their own in the event that a county has chosen to opt out. Just wanted to clarify that language. And now I'll open up the floor for discussion before we actually vote on this particular motion. Jan, you have your hand raised.
Yes, I was curious in the wording there, of course, it covers the teachers because you say, and the staff, you say for all individuals in all indoor school and childcare setting. But when you talk about childcare settings, preschool, daycare, are we not interested in unmasking those under 2? It's a little hard. This seems to me to cover infants up to 2.
Jennifer, did you have an answer for that?
The CDC recommendation is 2 and above, so we would not do this for infants or under 2. So we could amend this to specify that we mean all schools, like it could be preschool or kindergarten through 12.
Okay, thank you. That's what I was wondering.
I'd just like to clarify that right now the Board of Health is just making a motion to approve a mandate for a mask mandate for school-age children, but the details of how the public health order will be implemented will be in the order that the Tri-County staff will be creating after and if the board actually approves this motion. So are there any other questions or comments about this language, about this particular motion before we move to a vote? Okay, I'm not seeing any other questions or comments. Oh, Jan, did you have your hand raised again?
Yeah, I'm just not sure if it's mentioning 2 and above in other motions. I'm not sure why it wouldn't be in this one.
So, Julie, would you accept an amendment that clarifies that this would not apply to children under 2?
Yes, I accept that amendment.
Okay, great. I'm looking to make sure there aren't any questions or comments. And at this point, I will call for a roll call vote. Please, after your name is stated, indicate whether you approve or you disapprove of this motion. Renee, could you help us with the roll call vote?
Yes. Let's see, from Adams County, Rosanna Reyes. Please.
I vote
state-
Yes,
I'm
I
sorry.
vote yes for the motion.
Julie Schills,
I vote yes for the motion.
Julie Mollica.
Yes.
Sorry, I'm also recording the votes as we go. From Arapahoe County, Jan Brainerd,
Vote yes for the motion.
Dr. Thomas Faywell,
Disapprove.
Dr. Kaya Gallagher,
No.
Dr. Linda Fielding from Douglas County,
No.
Kim Muramoto from Douglas County,
No.
and Zach Nanestead from Douglas County.
I abstain.
Okay, it looks like,
Hold on, Zach, I need you to state the reason for your abstaining.
I am employed by one of the districts that would be affected by this vote.
Thank you.
okay, thank you. It looks like the motion did not pass. And yesterday, the Board of Health considered a second option. So, Dr. Faywell, did you want to introduce the second option?
Yes, move that to authorize and direct the executive director of Tri-County Health Department in response to the COVID-19 pandemic and in the absence of an approved vaccine for children under the age of 12 years to issue public health order requiring the use of face coverings for all children aged 2 years to 11 years, as well as all individuals working or interacting with children aged 2 to 11 years in all indoor school and child care settings located within Adams, Arapahoe, Douglas counties. I would like to add said public health order to become effective the start of school on August 23rd, period. Health data collection to be continuously monitored until this public health order is rescinded based on the ongoing data. Per Board of Health policy, counties have the option to opt out, and if a county exercises that right, it does not preclude any school, school district, or child care facility from following the public health order.
Thank you. Is there a second?
Gallagher,
Yes. Is there a second?
Rosanna, you were muted. You're muted, Rosanna.
yes. Dr. Gallagher, I move to postpone consideration of this motion until we get further clarification regarding the denominator for the Mr. Nanestead, who chose at this time to abstain.
Well, Rosanna, there's a motion on the floor that we have
Yes, that's
to.
why I chose, I'm asking, I had my hand up prior to that. I asked to postpone for 10 minutes till we can get a clarification regarding the denominator. Robert's Rule of Order clarification.
Okay, let me try to understand this. So you would like to take a 10-minute break and ask a question about the denominator on the abstention of the previous motion?
Yes, about the denominator. Mr. Nanestead's abstention of being considered in the denominator. And that would relate to the majority or not of the motion passed. So we need a order definition.
Well, let me just go back and ask Ronnie to confirm. But as far as I knew, there were 4 in favor of the previous motion and 4 against, which means that we did not approve the previous motion.
Well, in fact, is not Ms. Malika our parliamentarian as opposed to Ms. Brockman for the board?
Julie,
So-
did you?
Okay. So unfortunately, a motion's on the table, so we need to respond to that motion first.
Okay, but I did have my hand up prior to Dr. Faywell beginning our motion, their second, and it has not been seconded that I heard.
Mm-hmm.
So that's why I wanted to postpone and get an interpretation about the denominator. Robert's Rule of Order interpretation.
I'm sorry I didn't see your hand up, Rosanna. I just can't scan everybody's.
I know it's difficult, right?
But I am going to second Dr. Faywell's motion at this point, so that there's a motion on the floor that we can vote on, and then we can go back to your question about the previous motion. I'm postponing the discussion about the denominator until we move forward on the vote that's on the floor right now that has been proposed and second.
After my question. I just want that to be in the record that it was after my question.
Yes.
You chose to
right.
nominate. You chose to second, and actually, I think, isn't that also supposed to be a Board of Health person? Not the president, but doing a second?
I have the ability to second a motion. So Ronnie, could you please call the roll call on this motion that's on the floor? And then we will go back and explore the denominator question for the previous motion.
Yes, Julie Mollica with Adams County.
Yes.
Rosanna Reyes with Adams County.
Could you reread the motion, please?
The motion is on the screen. Did you want Dr. Faywell to read it again?
Well, I didn't get to hear the whole thing because I had my hand up. I was trying to maneuver that. So no, I can read it, but it's going to take me a moment.
Okay.
So come back around to me.
Okay.
Because Adams is always first somehow.
Okay.
Well, we do go alphabetically, just for the record. If you would prefer that I mix it up a little, I can get wild like that.
No, that's fine. I just needed time to read it.
Okay.
Julie, there was additional verbiage added. So to be fair, I need time to read this. I'm not asking Tom to reread it.
Perfect. I will come back to you at the end, Ms. Reyes. Julie Schills.
Yes.
Jan Brainerd with Arapahoe County.
Yes.
Dr. Thomas Faywell with Arapahoe County.
Yes.
Dr. Kaya Gallagher with Arapahoe County.
Yes.
Dr. Linda Fielding with Douglas County.
No.
Kim Muramoto with Douglas County.
No.
And Zach Nanestad with Douglas County.
I abstain for the aforementioned reason.
And Rosanna Reyes with Adams County.
Yes, I have a question. What is the total? Voting total to this point?
5, 4, and 2 against.
5, yes.
4 noes, 5s, and 2s against. As much as I believe that children over the age of 12 also need to be wearing masks, as I stand with the American Academy of Pediatrics of Colorado. In Colorado, as well as pediatric pulmonologists that I know and believe, I will vote for this reluctantly.
Thank you, Ms. Reyes.
Okay, so getting back to Robert's Rules of Order, Julie Mullica, our parliamentarian, we now have a motion that has passed that is on the screen right now. And Rosanna had a question about the previous motion, the denominator, And Rosanna, if I understand correctly, your question really was, what's the denominator? Because it was a 4-4 vote, 4 against, 4 in favor, 4 against.
Yes, and Mr. Vanistad had informed us that he was going to abstain. The denominator would be, that's what I wanted a official Robert's Rule of Order.
I think I affirm. So I think moving forward, since the motion has passed, but I still think, Rosanna, that you have, it's an important question for the public to know and understand the reasoning behind that and how Zach abstaining, how does that affect the vote? Is Sid or Randy, is there somebody who could speak to that?
Yeah, I would just say that there's been 2 motions that have been presented. One did not have sufficient votes to pass, so did not have majority, so it failed. The second motion had, I think, a 6-2 vote, so it passed. Any specific questions you want to ask?
Yes, I needed to know what the ruling, where it was in Robert's Rule of Order. When we knew someone who's not had chosen to abstain and stayed in advance, that individual will still be considering the denominator.
There weren't sufficient votes.
Yes.
There weren't sufficient votes in the first motion to pass, and so it failed.
Yes, but we also had a question from the public. Are we following Robert's Rule of Order? So in keeping with that, I wanted to know where it was in Robert's Rule of Order that when someone notifies you they're not voting, they're abstaining, does that affect the denominator?
Well, it seems like it would affect the denominator for sure, but you would still need a majority for a motion to pass. You know, if we have an even number and it's split 4-4, that doesn't indicate that the motion was approved.
No, but in instances, other small boards such as we are would go for another round of voting. That's why I wanted some clarification, because hopefully this will be a separate situation again, but in case it is, we needed to have something official in the record.
Okay, so are you asking for us to take a second vote on the first motion that already failed?
No, I'm asking you for the rationale and the site in Robert's Rule of Order for small boards. Where is that? That's what I'm asking, because it was a question also from the public. I'm not asking for a second vote at this point.
Rosanna, I guess I have to say that I'm not entirely certain what it is that you are looking for. At this point, for the first motion, we have 4 in favor, we have 4 against, and we have Zach Nanestad who abstained due to a conflict of interest. And that's my understanding that that is a perfectly fine reason for abstaining. So I guess
yes, that's not a question at all. That's not my question at all. That's not my question.
Okay, I mean, the other thing is in the Board of Health bylaws, it clearly states that in order for a motion to pass, it has to receive votes when a quorum of the board is present, and it has to be a majority vote in order for that motion to pass.
Yes, and in our rules as well, our bylaws, we also refer to Robert's Rule of Order revised, I believe. So that's why I wanted to know the site. A member of the public asked the question, are we following it? So I wanted to know where that is in Robert's Rule of Order.
You know, Rosanna, I understand.
We can table that for another to be researched and for another meeting.
Yes, I think that's a good suggestion. I understand the question that you're raising, but no one seems to have an answer right now. It does seem to be an issue we need to research. But
I move we lay the question, lay it over.
We already have a motion.
Okay, so here is where I believe we are. We have a motion that the board approved regarding mask mandates in schools. It was passed by 6 votes in favor and 2 against, with 1 abstention. My understanding is that the next step is that the Tri-County Health Department staff will actually work through the details of that public health order. Within a matter of days, the order will be posted on the Tri-County website. It will also be shared with our school districts as well as local government officials. We appreciate the members of the public who have shared their opinions with us, and please recognize that we will continue to monitor the spread of COVID within our schools and consider modifying our order accordingly, which is actually part of the language that Dr. Faywell inserted into this motion. Are there any final comments before we end this meeting? Not seeing any. Thank you all for your very hard work, diligent attention to this issue. We're all concerned about making sure that we make the best science-based decision, and this is a conversation that I'm sure will continue. In particular, Rosanna, we will pay attention to the Robert's Rules of Order and just know what it was that we needed to do relative to the denominator question. So at this point, do I have a motion to adjourn the meeting?
So moved.
There a second?
Second.
All in favor, say aye.
Aye.
Anyone opposed? Thank you very much. Have a great evening, and we will continue our conversation.
Kaya, one question. Who seconded that motion to adjourn?
I think it was
Zach.
Zach did.
Okay,
Zach?
thank you so much. I just wanted to make sure that it was accurately reflected in the minute.
Thank you. Thank you, everyone. Have a good night.